Hi, I'm Dr. Duke, and this is Run Smart, New York. Today, I have turbocharged sports medicine for you. We're going to talk about plantar fasciitis. The plantar fascia is a big sheet of connective tissue at the bottom of the foot, and it plagues a lot of runners and triathletes. It's a catch-all phrase. It means inflammation at the bottom of the foot. Except what happens is that it irritates the nerve at the bottom of the foot. It causes bursitis at the heel. It also causes spurs to form at the calcaneus. Feels like you're walking around on a marble when you first get up in the morning. It's terrible. So let's see if we can put an end to like this big sheet of connective tissue on the bottom of your foot and try to limber it up a little bit. All right, that's what our purpose is today. Generally, there's a lack of mobility and glide and slide to these tissues. So let's put some mobility in the ankle first. Get into like a sprinter stance. And what I'm talking about, I need this leg to come up higher towards your other toe. This knee up higher. There we go. Now lean back into this. That's mobility. Because I want that Achilles to feel some tension on itself. And then you hold it just for about 10 or 15 seconds. And this is turbocharged sports medicine. So we got to kind of make this go a little faster. After you do this, let's get into the front of the shin. So now put your leg down, lean back, and I want you to grab that shin and pull it all the way up. Come on, you could do it. Nice. Now we're getting a good mobility stretch to the front of the joint. So now we have mobility to both the front of the joint and the back of the joint. Now what we have to do is try to stretch the area. We want to work on some flexibility. So one of the stretches that I like is this. Put like a ball up against the wall and get your shin all the way parallel, all the way down. Get your other leg forward. Keep this heel against your butt. Come nice and tall. Lunge into it. And then try to get the glute touching your heel again. Come on, you got it. Yes, that's a beautiful stretch to the front of that thigh. That's a pretty aggressive stretch. You're going to ease into this one. Now let's come out of this. Good. And let's get into a lunge. Like a nice big lunge stretch. Get this leg down on the ground. First get stable. Now bend this leg. Try to grab it with your hand. And now get deep into the lunge. You have to remember that the hip flexors and the quads cross two joints. So you want to stretch it at the knee, and you also want to stretch it at the hip. Mobility all the way down and all the way up the chain, the kinetic chain, it helps the plantar fascia. All right, let's get out of this stretch. Come on up. Let's show them how to stretch 3 different ways to attack the back part of the calf, because you have the posterior compartment. First, let's show them a calf stretch, a basic calf stretch. Put one leg back, and just hold your leg straight. This is getting the gastrocnemius, the big calf muscle. Now bend your knee. Now come out of that. Turn your foot towards me. And now gently just bend it halfway. Nice. And that's getting something called the tibialis posterior. Tib posterior lies underneath the gastroc, lies underneath the soleus. It's part of something called the posterior compartment. And the posterior compartment are these tendons that run all the way down and underneath your foot. They flex your toe, they flex all your toes, and they flex your entire ankle. So if you don't do these stretches, you're kind of missing out on trying to help the plantar fascia. Now besides mobility and flexibility, you need strength. So one of the things I like to try, take a seat on the floor for me. Take a dining band, hook it up to like the bottom of a door or a piece of furniture. And I want you to keep your foot flexed, and now gently point and flex back up. Notice the tib anterior. What we're trying to do is strengthen that muscle, because the tib anterior runs down and attaches to a bone in the arch of your foot that keeps your arch up. It actually keeps it stable. So when you get plantar fasciitis, sometimes the arch falls in. And people are like, oh, I need to get orthotics, I gotta fix that. You want to know what? Maybe you don't need orthotics. Maybe you just need some good turbocharged sports medicine working for you. So that's one way to strengthen this up. Stand up for me. Let's kind of go back here. Can you zoom in on her feet a little bit? Now I want you to dome your foot. That's it. And now kind of step around a little bit. You want to get the arch of your foot stronger because it's getting stretched out, it's getting torn, it's getting shredded when you're running. That's why it's inflamed and irritated and tugging on the calcaneus, giving you that bone spur. You also want to point your toes up in the air. Good. Step around like that. I want you to kind of practice these exercises because this is what strengthens that area. So we had mobility, we had flexibility, we had some strength training to it. Now, let's try to get some slide and glide. All right, take a seat again on the mat. Take a rumble roller or some other massage foam roller. Put it underneath your calf because like I said before, the posterior compartment lays underneath your calf and it runs to the bottom of your foot and it flexes your toe and all your toes and your ankle. So I want you to massage this out, and as you're doing this, I want you to roll it in and out, and I want you to flex your ankle up and down. That's a nice way to try to knead into those tissues. Then, let's take a massage ball of your choice. I happen to like the Beastie Ball. Well, let's get you standing up for me. And the plantar fascia has 3 different arches. You have the medial arch. All right, so now we have to stand up, and I want to give a little explanation about the feet. The plantar fascia makes up your arch of your foot, and it's like a triangle. It attaches to your heel, but you have a medial arch, a transverse arch, and a lateral arch. So you want to take the massage ball of your choice, place it on the medial arch first, and there's no rolling. You're just gonna mash it in, and as you smash it down, I want you to lift your big toe up. So we start with the medial arch, get some pressure there, move it maybe towards your heel a little bit, press down, crunch your toes, flex them back up again. Good. Now let's move it over to the transverse arch, right in between the metatarsal heads. This is where people get neuromas from wearing shoes that kind of squish your toes too tight. When you kind of smash into here, it spreads your toes out. So this is great for preventing a neuroma from getting irritated. And then move over to the lateral arch. And I want you to move down enough where you press into it. You almost see the 5th head of the metatarsal raise up in the air. This is where a lot of runners get stress fractures. They also call it like a dancer's fracture to that metatarsal head, the 5th metatarsal. So it's good to kind of knead this out. Because when you have plantar fasciitis, what happens? You don't want to hit on the inside of your heel. You start rolling naturally to the outside. So it's really important to kind of get this outer part over here. Last but not least, you want to get rid of inflammation. So I kind of like the idea of using a frozen water bottle so you can massage and cool down your plantar fascia at the same time. I'm Dr. Duke, and this was Run Smart New York.